Hello everyone. Our topic today is anemia. Without further ado, let's get started. What is anemia? Anemia is a disorder when there aren't enough healthy red blood cells to adequately oxygenate your body's tissues. You may experience fatigue and a lack of strength if you have anemia, commonly known as low hemoglobin. Anemia comes in many different kinds, each with a unique etiology. Anemia can be mild to severe, short-term or long-term. Anemia frequently has multiple causes. If you believe you may have anemia, consult a doctor. It can be a sign of a serious sickness. There are many different types of anemia, including aplastic anemia, iron deficiency anemia, sickle cell anemia, thalassemia, and vitamin deficiency anemia. Depending on the underlying cause of anemia, treatments might range from taking supplements to receiving medical attention. Eating a healthy, balanced diet may help you avoid some types of anemia. Etiology of anemia. This could occur if your body isn't producing enough red blood cells, you're bleeding, and your body is destroying red blood cells as well as losing them more fast than it can be replaced. Congenital anemia, which is a disorder present at birth, and acquired anemia are two different types of anemia. Acquired red blood cells in your blood are insufficient, which causes anemia. Therefore, there are several types of anemia that can be classified, such as iron deficiency anemia, vitamin deficiency anemia, anemia of inflammation, aplastic anemia. Next is disease of the bone marrow that can cause anemia, hemolytic anemia, and last but not least is sickle cell anemia.
Now we're going to talk about the pathophysiology of anemia. First, decreased RBC production. This can be due to aplastic anemia due to dysfunctional bone marrow. Second, deficiency of folic acid. Lastly, most common cause is iron deficiency. Moving on to, when there is increased RBC loss or destruction. This can be due to sickle cell anemia. Secondly, blood loss during medical or surgical process. Lastly, infection. This can be associated with chronic infection, inflammatory process or tissue injury.
How about the sign and symptoms of anemia? Okay. The signs and symptoms of anemia is, firstly, fatigue, which is the most obvious anemia symptom and occurs when you feel too exhausted to manage your tasks. Secondly, is pale and yellow skin, which can cause your skin to appear paler than usual. Next, signs and symptoms is a rapid or irregular heartbeat, or also can be known as arrhythmia, which causes you to feel as though your heart is racing or skipping beats. Furthermore, the signs and symptoms can also be shortness of breath or dyspnea, which is the inability to take a deep breath or catch your breath. Next, signs and symptoms is feel lightheaded or unstable on your feet, in which is another indication and symptom of anemia, along with dizziness. Patient with anemia also will be having a chest pain, which can feel like it is being squeezed or pressed against. Moreover, anemia patient also will experiencing headaches, which can be brought on by iron deficiency anemia, low hemoglobin anemias, and other anemias. And last but not least is having cold hands and feet.
Next is the investigation of anemia. So what can we investigate patient with anemia? The investigation can be such as complete blood count, peripheral blood film, hemoglobin, electrophoresis, reticulocyte count, as well as direct and indirect comb test.
Next, I'm going to talk about the treatment and management of anemia. As for the treatment and management of anemia, doctor in charge will first ascertain if the patient anemia is brought on by a bad diet or a more serious medical condition. The doctor might suggest seeing a hematologist, a medical professional who focuses on blood diseases. Firstly, if the patient is having pernicious anemia or iron deficiency anemia, doctor may advise modifying your diet or taking supplements. Anemia is brought on by a persistent illness, doctor will take care of that illness first, or in other words is by taking care of underlying causes first. Several types, therefore. Here is the explanation of the treatment on each of anemia types. Firstly, is aplastic anemia, in which patient with this types of anemia need to take a medication, undergo blood transfusion, or also can be bone marrow transplant. Next is hemolytic anemia, whereby patient need to take medication in which it helps in holding back the immune system. Moreover, iron deficiency anemia, the treatments can be iron supplements as well as diet changing. Next, types of anemia, which is sickle cell anemia. The treatment is such as folic acid supplements, intermittent antibiotics, also with hydroxyurea. Furthermore, patient with vitamin B12 and folate deficiency, they need to take supplements. And last but not least, treatment of the thalassemia, The patient need to undergo blood transfusion, surgery, as well as bone marrow transplant.
What can we do to prevent from getting anemia is firstly by taking dietary sources of iron include lean red meat, eggs, oats and cereals can prevent anemia. Next is by consume foods with high amounts of vitamin C such as citrus fruits and fresh, raw vegetables. Lastly, is taking vitamin that contain iron. However, if take iron supplements with orange juice, avoid calcium fortified variety.
As for the conclusion, anemia is a condition in which a person lack of enough healthy red blood cells to carry adequate oxygen to their body's tissues. Having anemia can make a person feel tired and weak. There are many forms of anemia, each with its own cause. Anemia can be temporary or long-term.
Thank you everyone.